Folks, it is a very rainy Friday evening. We're going to go ahead and talk about one of everyone's least favorite topics, stroke management. I still remember when I first heard about the concept of stroke back when I was at undergrad and thinking that all I could think of was heat stroke because I had lived in warmer areas for a long time. And it was just sort of even hard for me to conceptualize even the very basics. So it's kind of funny looking back on it now as essentially a fourth year medical student, how much more I understand, and yet at the same time, how little I understand about stroke. So let's go ahead and dive in with the knowledge that I do have, at least at this point in my education, and how that pertains to getting step two CK questions correct. All right. So let's say that you have somebody coming in and they're a 71-year-old male. Uh, they don't really have any crazy pertinent medical history. We can give them the usual hyperlipidemia, hypertension, diabetes type 2, blah, blah, blah. But they haven't ever had a stroke before. They've never had a hemorrhage before. They've never had a major heart attack before. For the most part, they're doing all right as far as a 71-year-old could go. And they say that they come in and they have got left-sided weakness, and it seems like their face doesn't seem right. So we're thinking they've met the fast criteria, and you come to find out that it's only been 90 minutes. All right. Um, let me sidetrack myself there shortly. Remember, if it's been 90 minutes, you have a time frame. But if they tell you that that happened when they've woken up, then they've already not met any time restrictions because you have to take it as though it happened the second that they fell asleep. So just keep that in mind. If you ever get a question, which they come up decently often, where they'll say, "Oh, they've woken up and now they feel that they have these stroke-like symptoms." Okay, well then for that person, it's just uh, the longest. They haven't met any of the time minimums. But in this particular case, it's only been 90 minutes, and they come in, and at any reputable medical center in the United States at this point, you're going to end up getting a non-contrast CT scan. So in this particular case, what will happen is they'll have a hyperdense right middle subcerebral artery. Okay. And then we'll say that you follow that up with your contrast CT. And the contrast CT is telling you that that area is not getting blood. All right. Now, they made it kind of easy for you in that case. You really want to basically hone yourself in that for a CT, a hyperdense right middle cerebral artery is telling you that that area has not been getting blood. Okay. But the simultaneous contrast CT that happens afterwards will tell you that the blood flow is low, and they might even tell you that there's non-match between the penumbra as in the core. Okay, so what do we do for this person? Well, it's only been 90 minutes. So since it's been lower than 4.5 hours, they are eligible for the thrombolysis, like an alteplase, but only because they've never had a hemorrhage before. So since they've never had a hemorrhage before and it's less than 4.5 hours, you can give them any of the places, PLASE. Okay, but what about mechanical correction? Well, it's important to consider these things separately. Mechanical correction can be done within 24 hours of symptom onset. Okay. So that means for him, you can do both a thrombolytic treatment as well as a mechanical thrombectomy. All right. Because of this ischemic, possibly correctable infarction. Cool, 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 cool. All right, so if all you want to do is just hear a little bit more about stroke, you can go ahead and tune out. I'm going to cover a couple other quick things. One of them was a weird question that I saw about ears in kiddos, and I'm interested in going to pediatrics myself. So this was sort of an interesting one. But what would you do if a kid had a recent ear infection, maybe 2 weeks ago, but now they're coming back in and they have bilateral ear discomfort? Well, it doesn't matter. They're scratching at it, or it just seems like they keep slapping at their ears. Some sort of indication that the kid is bilaterally unhappy with both of their ears. To put an age on them, we'll say that they're 16 months old. Okay. And then on otoscopic examination, you'll see that both of the tympanic membranes are not really going in and out the way that they normally should. All right. Well, what are we talking about for this person? Well, we're talking about a otitis media with effusion, right? There's no redness. There's no angriness going on anymore. So even though they had a recent ear infection, doesn't necessarily mean that they have an ear infection again at this time. In real life, this is a supremely large point of contention because if you have otitis media with effusion, then you don't give them antibiotics. But what are people always wanting? They're wanting antibiotics. But this is the classic pediatric answer of observation and follow up. So reassurance, right? The last thing I'm going to cover is happens to be another pediatrics question. And this time it's not an ischemic stroke in a 4-day old, but rather a intraventricular hemorrhage. Now, what are we talking about with an intraventricular hemorrhage in a 4-day old? Well, we're talking about risk factor. We know that step 2 really likes risk factors. What is the main risk factor for hemorrhage in a neonate? Yeah, as it turns out, it is prematurity. So we know that babies typically should be born around the 39th week of gestation. But it's important to know that a lot of the blood vessels that have to do with the brain are really, really getting to their appropriate maturity around 32 weeks. So if you had a baby that was born even at the 33 or 34-week period, but especially 32 weeks or before, you really have to keep in mind that it's possible for them to have hemorrhages, which might originally manifest themselves as things like low tone, not moving very much, poor breathing, but especially seizures is kind of the one that maybe distinguishes itself from some of the other things like uh, apnea of prematurity. Okay. Well, I'm going to go ahead and sign off on this call before the storm rocks this house to oblivion. You have a good night.